Surgical assisting, prep to post-op, monitoring of the anesthetized patient. Very often, it will be the responsibility of the surgical assistant to monitor the patient during surgery, allowing the surgeon to focus on the procedure itself. Monitoring and charting patient vitals is an important part of assisting the surgeon in knowing the status of the anesthetized patient. Monitoring body core temperature becomes especially important with extended surgical procedures. Anesthetized patients will often become hypothermic or develop a low body core temperature, which can significantly delay recovery time. Taking a rectal temperature will make you aware of these changes. Some electrocardiogram machines use an esophageal temperature probe that is useful in monitoring core temperature. The use of a specially designed water circulating heating pad and pre-warming IV fluids to body temperature can help avoid hypothermia. Pulse quality and heart rate is another significant vital sign the surgical assistant will need to monitor. Many types of surgical monitors are available that will make the heart monitoring more accurate. ECGs, stethoscopes, non-invasive blood pressure monitors, and pulse oximeters are all common instruments that will alert you to changes in the circulatory health of the patient. Along with electronic monitors, you will need to manually palpate the quality and strength of the pulse in addition to calculating the ausculted heart rate. The heart rate per minute is derived by counting the number of beats in 15 seconds and multiplying by 4. Compare the calculated heart rate to the electronic monitor's readout. It should be noted that ECGs can sometimes be misleading by only showing the electrical activity of the heart muscle. Evaluating the palpable strength and quality of the pulse verifies proper blood output by the heart. ECGs are useful, however, in verifying heart arrhythmias or abnormal heart rhythms. A palpable pulse deficit can be compared to the ECG readout to determine whether patient intervention is needed. A standard stethoscope can also be used on the patient's chest, but be careful not to disrupt the sterile field. A pulse oximeter is especially useful because it monitors both heart rate and blood oxygen saturation in one step, evaluating pulse and tissue perfusion. The color of the gingival or mucous membranes is another indicator of cardiovascular status. The patient's gums should remain a pink color, and this color should quickly return when the gums are pressed gently with your fingertip and released. This evaluation is called capillary refill time, or CRT, and indicates sufficient peripheral blood flow and tissue perfusion. It will generally take less than 2 seconds to regain a normal pink color in the gum tissue. In many hospitals, non-invasive blood pressure monitoring during surgery has become a valuable indicator of heart and circulatory status. When blood pressure is assessed, the patient's blood pressure should remain above 90 millimeters of mercury systolic pressure and above 60 millimeters of mercury diastolic pressure. Monitoring respirations involves making sure the patient is taking regular breaths. This can be done by watching the movement of the chest and observing the rebreathing bag on the anesthetic machine. To calculate a respiratory rate per minute, count the number of inspirations taken in 15 seconds and multiply by 4. Many surgery patients will benefit from IV fluid therapy during the surgical procedure. Fluids help support the blood pressure when an animal is anesthetized and serve to help replace fluid loss associated with bleeding. The fluid administration rate will be determined by the veterinarian. You should pay attention to the drip rate to assure proper fluid levels are being administered. Fluid pumps regulate this drip rate very accurately and can be programmed to alarm you if this rate is altered. The volume of fluids remaining in the bag should be monitored even when using a pump, since malfunctions could occur, leading to over or under delivery of fluids. Your surgical assistant's role in patient monitoring is a crucial link in anesthetic safety. Your careful assessment of patient status will not only ensure a successful recovery, but also reduce recovery time and avoid health complications due to anesthetic injuries.